Hi, my name's Jayden Miles, and I'm a second year pharmacy student at Idaho State College of Pharmacy. And I've been given the opportunity to kind of talk about my own experience on why I chose pharmacy school and why I chose Idaho State University. Just a little background about myself. I graduated from the University of Utah with a Bachelor's of Science in Biology, and that's where I'm originally from, is Utah. And my I'm married, and I've got two little girls, and a third on the way. And one of just wanted to mention why I chose pharmacy school. Throughout my undergrad, I've always been interested in the healthcare field, and there was opportunities for me to kind of check out what the healthcare field had to offer. So I shadowed an orthopedic surgeon, and I shadowed a clinical pediatric pharmacist at a hospital. And then I was also involved in a class at the University of Utah that allowed me to be involved with pediatric clinical research. And that was a great opportunity for me to kind of see if I enjoyed being around patients and working with other healthcare professionals. And that was really helped me out to kind of figure out what route I wanted to go. In my undergrad, I also enjoyed taking classes like anatomy and physiology, and among other courses that are required to take before applying to pharmacy school or medical school. And and yeah, physiology really kind of drove it home for me. I like learning about the body and how the body functions properly, and how what can happen to the body if it's not working properly. And pharmacy for me is a way to understand how to fix physiological processes in the body through medications, and managing patient health long term and for acute situations. And I was also exposed to pharmacy at a young age. My dad's a pharmacist, and I remember while growing up visiting him at the local retail grocery store, and getting a snack with my mom and saying hi to my dad. And that's always been kind of a childhood memory for me that I've appreciated, having exposure to pharmacy in that way. um, I chose Idaho State University because they have a good reputation for making great pharmacists. The pharmacist that I shadowed at the hospital on the pediatric floor, I mentioned to her that I was considering ISU, and she said, "Oh yeah, that's a great school. They come out with great pharmacists. That's a really good option for you." And personally, for my family and I, we wanted to move out of state, and I really loved my time at University of Utah, but we also wanted to get kind of an experience away from family, and kind of figure things out on our own. And Idaho has been a great place for us to move and to yeah, kind of be out on our own and explore a little bit. And on top of that, it was also a lot cheaper for us to go out of state even than to stay in state, for any of the other schools or pharmacy schools in Utah. And since starting the program, I can always honestly say that I've really enjoyed the classes and the program as a whole. The faculty are amazing, and they're always on our side and trying to help us do our best, and they really want us to succeed. And they give us a lot of opportunities to be involved with the community, whether that be through giving flu shots or testing cholesterol and testing blood glucose. And we also do hours in the summer, like intern hours in the summer, that give us 3 weeks of experience in different pharmacy scenarios. And those are really helpful for me, because pharmacy has a lot of different avenues that you can go down. It's not just working at Walgreens or working at CVS, but you can work in the hospital. You can work in a nuclear pharmacy, which makes isotopes for kind of scanning and diagnosing. Or you can work in industry and help create new drugs, and work on a team to create new therapeutics. And yeah, just a lot of great options within pharmacy. So it's kind of the beginning of the road once you start pharmacy school. But yeah, I would highly recommend pharmacy school to anyone that's considering a career in the healthcare field, and if they're interested in science and patient care. But yeah, I appreciate your time, and thank you.